Hello and welcome everybody. Thank you for taking the time to participate in our educational program, which is titled Bridging the Gap Between Artificial Intelligence and Medication Safety. This is to assess the effect of a pharmacist-led educational program on AI chatbot assisted self-diagnosis practices among young adults in urban Bengaluru. And this is a pre-post interventional study. Before we begin, we hope that you have completed the pre-intervention questionnaire, and if you haven't, we kindly request that you pause the video, complete the questionnaire, and then return to the video. Now, without further ado, let's get started. Let's begin by exploring why the use of artificial intelligence in healthcare has become such an important topic of discussion in recent years. So, artificial intelligence is increasingly being used as a source of health information. Right? Many people now turn to these AI chatbots to understand their symptoms, look up possible illnesses, or even decide which medicine to take before consulting a healthcare professional. And although while AI can be a valuable support tool by providing quick and easy accessible information, relying solely on its recommendations for healthcare decisions can carry significant risks, especially when it comes to self-diagnosis and self-medication. So as clinical pharmacists, we have an important role in promoting the safe and responsible use of medicine. Therefore, this study focuses on improving the awareness of the appropriate use of AI for health information while encouraging the informed decision making and emphasizing the importance of seeking professional healthcare guidance whenever possible. So ultimately, our goal with this study is to help reduce the preventable drug-related problems and to improve medication safety. Before we move further, I'd like to clarify the main objective of this study. So this study is not intended to either support or oppose the use of AI in healthcare. Instead, our aim is to promote the safe, informed and responsible use of AI-assisted self-diagnosis while emphasizing the medication safety and the importance of consulting qualified healthcare professionals. So as AI becomes increasingly integrated into our everyday healthcare decision making, it is essential to improve the digital health literacy among the general public. So by educating individuals on both the capabilities and the limitations of AI, we hope to encourage the safer self-care practices and more informed medication-related decisions. Now, to better understand why AI is becoming so popular for health information, let's first look at the reasons behind its growing use. So, why are people using AI for self-diagnosis and self-medication? So, there are several reasons why people are increasingly turning to these AI chatbots for health-related advice, and one of the biggest advantages is convenience. AI is available 24 hours a day, which allows user to receive the immediate responses without the need for any sort of appointments or long waiting times. It can also be accessed from almost anywhere using a smartphone or a computer. And another important factor is privacy. Many individuals feel more comfortable discussing the sensitive or rather embarrassing health concerns anonymously with an AI chatbot rather than speaking to someone directly. In addition, busy schedules, travel difficulties, and the relatively low or no cost of AI tools encourage many people to seek the AI-generated advice before consulting a healthcare professional. So with this growing popularity, an important question arises. How common is this practice? So to understand that, let's look at the available prevalence data. Globally, around 16% of adults have used a generative AI for health advice, which represents well over 1 billion people. In India, studies suggest that around 40 to 70% of adults have attempted some form of self-diagnosis or self-medication before consulting a healthcare professional. And since India is one of the largest users of ChatGPT and similar AI platforms, it is estimated that around 15 to 20% of the population have used an AI chatbot at least once for a health concern. And in Bengaluru alone, although self-diagnosis and self-medication are believed to be common among young adults, There are currently no sufficient studies that specifically quantify the AI assisted health information seeking or self medication practices. So, this lack of local evidence highlights an important research gap which forms the foundation of our study. Despite Bengaluru being recognized as India's IT and AI hub, there is very limited published evidence regarding how people are actually using these AI chatbots for either self diagnosis or self medication. And at present, there are no published studies that accurately measure the prevalence of AI assisted self medication practices or evaluate the associated drug related complications among the adults in Bengaluru. So, this significant evidence gap emphasizes the need for a pharmacist led community intervention study that not only assesses the current practices but also improve public awareness regarding the safe and responsible use of AI for health related decisions. So it is this gap in knowledge that provided us the opportunity for conducting this present study. Now my friend Leeksha will continue the next part of the presentation.
So, the first we need to understand the limitations arise from both ends. There are the user errors as well as the limitations to the AI chatbots. So, first let's look into common user errors. So the common mistake include is, first, you will be providing incomplete or inaccurate information, because due to that you will be having misinterpreting AI generated information, or it is assuming that AI is always correct without verifying the information. So some of the users, what do? They repeatedly ask the same question until they receive the answers they were hoping for it. So while the others rely AI even during medical emergencies or ignore the warning signs that will require immediate medical attention. So another major concern is that you will be carelessly sharing a sensitive health information without considering any privacy implications. So that's the reason the user related factors can also significantly affect the quality of AI generated advice. Another thing you have to know is, even if AI is correctly used, it's important to recognize that the technology itself has few certain limitations that we have to understand. So what are the limitations of AI chatbot is what we'll see now. So one of the biggest limitation is that they cannot perform a physical examination, which is essentially required for an accurate diagnosis, and they might not even access a complete medical history unless the user provides the information, and they may not have full account for an individual factors like, for example, existing disease, commodities, allergies, pregnancy status, current medication, whatever they're using. So AI may not always assess the severity or the urgency of the condition correctly. So it lacks the clinical judgment, experience, accountability that a healthcare professional will bring it to the patient care. So technology will support care, but it doesn't replace a personalized evaluation. So now let's look into the risks of using AI for self-diagnosis and self-medication. So when AI generated information is used without an appropriate clinical judgment, obviously there will be arisal of several risks. So as I've already told you, if you're providing an incomplete information, it is gonna suggest you with an incorrect diagnosis, and that was gonna delay the medical consultation, allowing serious conditions to progress before the appropriate treatment is also given. And AI can also underestimate or overestimate the illness, where both can negatively impact the patient outcomes. So when individual begins taking medications solemnly trusting on the AI recommendations, they increase the risk of adverse reactions, inappropriate dosing, toxicity, and treatment failure. Other than that, it's inappropriate use of antibiotics. So why is it inappropriate use of antibiotics? Is that normally for a cold, cough, or whatever minor symptoms or illness, you are taking an antibiotic through OTC drugs or through doctor's recommendations. But an antibiotic is only given for a bacterial infection, not for a viral or not for any other infection. So rather, when you're taking an antibiotic simultaneously for any illness, it's gonna cause resistance to your body. So once this antibiotic causes resistance to your body, when you have a future bad bacterial infection, when you have given the same medication, it's gonna resist to your body and you will not be able to use that drug to recover. So that is why now the global concern is that there is antimicrobial resistance. So that must be stopped and not to be taken antibiotics in a frequent use. Other than that, you have certain medications such as painkillers, cough preparations, or sleep aids. This may be overused or misused when it is taken without a proper professional guidance. So that is going to increase in dependency and other complications. So other than that, what you'll be having is privacy issues. So many users may not be aware of how their health information is stored, processed, or potentially used after being entered into an AI platform. So understanding this data privacy policies is important in these kind of tools, and it is responsibility of the user to understand this. So what is the important key message is that AI can be valuable source of health information, but safe healthcare decisions require critical thinking, awareness of AI limitations, protection of personal health information, and appropriate consultation with a qualified healthcare professional. So why? Because AI should be reviewed as a decision support tool rather than a decision maker. So hope you guys did get the point.
Yes, to better understand why this is so important, let's look at these real life scenarios that demonstrate what can happen when these AI generated advice is blindly followed without proper clinical evaluation. So the first scenario is when the AI will underdiagnose the condition and fails to flag a serious condition. So let's watch this video on how the AI underdiagnosis can sometimes lead to delayed recognition of serious medical conditions.
A 28-year-old woman begins to suffer from a severe headache, nausea, and sensitivity to light. She turns to an AI chatbot for advice. The response? It could be migraine or just stress. Trusting the AI, she takes painkillers and delays visiting the hospital. But her condition worsens. The pain intensifies. She can barely stand. At the hospital, urgent tests reveal the truth. It wasn't migraine. It wasn't stress. It was meningitis, a serious infection that needed immediate treatment. The doctor warns, AI chatbots can mislead. Self-medication delays can be dangerous. Always consult a doctor for real diagnosis. Remember, AI is for information. Doctors are for treatment. Consult a healthcare professional before self-diagnosis or self-medication.
So now you guys would have seen how AI can underestimate a serious condition. Let's see the opposite of that. So that is nothing but overdiagnosis or unnecessary panic.
A 24-year-old man finishes his workout. Suddenly, he feels a mild chest discomfort. Confused, he turns to an AI chatbot for answers. The chatbot responds, "This could be a heart attack or a cardiac issue." The words hit him like a shock. Fear takes over. His breathing quickens. Anxiety builds. Convinced something is seriously wrong, he rushes to the emergency room. Doctors examine him carefully. Tests are run. The tension is high until the results come back. The truth? It wasn't a heart attack, just a minor muscle strain, a self-limiting condition that would heal on its own. The doctor explains, AI chatbots can create unnecessary fear. They cannot replace medical consultation. Always seek a doctor for real diagnosis. Remember, AI is for information. Doctors are for treatment. Don't let fear guide your health decisions.
So now that you have seen both the examples, it demonstrates an important point that AI doesn't only make one type of mistake, it can make mistakes in any of the directions. So it may underestimate a serious illness by delaying the treatment or overestimate a minor condition by causing unnecessary panic. So the key point that you have to take here is AI should be viewed as a supportive tool, information tool, rather than replacement of a professional medical judgment. Using it as responsibly means understanding both its strength and its limitations.
Okay, so far we've discussed all the strengths, the limitations, the user errors, the underdiagnosis, the overdiagnosis, and all of that. So now we need to see what we can do in order to get the best out of these AI health chatbots. And it's important to understand that the quality of an AI's response will largely depend on the quality of the information it receives. Right? In simple words, we can say that better questions will give us a better healthcare information. And to demonstrate this, let's look at a simple real-life example using the exact same health condition but with two different prompts. In the first example, the user simply asks ChatGPT, "I have a sore throat, what do you think it is?" And since very little information has been provided, the AI can only respond with a wide range of possible causes like viral infection or bacterial infection or allergies or acid reflux, and it cannot confidently narrow down the most likely cause because it lacks the important details that it requires. Now let's see what happens when the same person provides a more complete and relevant information. So in this example, the user provides additional details like their age, the duration of their symptoms, fever and painful swallowing and the swollen neck region, and all of the relevant information. So now with this more complete clinical picture, the AI is now able to generate a much more focused response, and it identifies it as streptococcal pharyngitis or strep throat in this case, which is the most likely diagnosis. And another thing that ChatGPT mentions here is that it clearly recommends seeking a professional medical evaluation for confirmation, and people usually overlook this part. Now when we compare these two responses side by side, the difference becomes very clear. So in the first prompt, it was very brief and it lacked the important clinical details, so the AI could only provide a broad list of possibilities. And in contrast, the second prompt included all of the relevant information that helped the AI generate a more specific, structured and clinically useful response. So the key message here is very simple. Better questions lead to better health information, but the final diagnosis and treatment decisions should always be confirmed by a qualified healthcare professional. So now the question arises that what information should we provide to get more meaningful and reliable responses from these AI health chatbots? So first we can begin by giving it some basic personal information such as age, gender, height, weight. Next we can describe our symptoms clearly. Instead of saying "I have a sore throat," mention where the pain is and how severe it is and whether it has been getting better or worse. And it's also important to include any associated symptoms such as fever, cough, difficulty in swallowing, nausea or breathing difficulties. These details help distinguish between the different medical conditions that may otherwise appear similar. And also we need to mention any existing medical conditions such as diabetes, hypertension, as these can influence both the diagnosis and the treatment recommendations. Alright, so now let's look at a few other things that you can include into your prompts. So you can mention the medications that you're currently taking, which includes the prescription medicines, over-the-counter medicines, or the herbal supplements, and even any recent antibiotic use. And this information is important because existing medications can influence both the symptoms and the treatment options that may be appropriate. Also, it's helpful to mention any known allergies, whether they're to medicines such as penicillins or NSAIDs or even food allergies. And this information is especially important when discussing the potential treatment options, as it helps to avoid recommendations that may not be safe for you. We can also mention any recent travel or environmental exposures. For example, if you've recently traveled or been in contact with someone who is sick or have been exposed to any sort of allergens or chemicals or animals, insects or pollutants. And these details can provide valuable clues that help narrow down the possible cause of your symptoms. And finally, you can also inform the AI about any recent changes in your diet or medications, including the use of new food or supplements or health products or OTC medicine, as these changes may also contribute to your symptoms.
So now safe medication use will depend on your own habits too. So one simplest method is that, effective method or effective habit is that you should read the medication labels before using any medicines. So these are the things that the medication label will provide: correct dosage, direction for use, warnings, contraindications, manufacturing date, expiry date. So these all will be there already in the labels. So that might help you prevent accidental overdosing, avoid taking duplicate medications that will contain the same ingredient. So this is your first step towards the safe medication use. So spending just 30 seconds reading the label can prevent unnecessary medication errors and improve your medication safety. So now let's look into why pharmacist consultation matters. That is nothing but clinical pharmacist, as we are. So consulting a clinical pharmacist before starting or changing a medicine can help you prevent many medical related problems. So what does this clinical pharmacist help with? They will identify potential drug interactions, which may be drug-drug interactions, drug-food interactions, drug-disease interactions, and even prevent medication errors, and verify the correct dose, duration of the treatment, and provide an individualized counseling based on the person's medical history and current medications. So they will also play an important role in interpreting the AI generated health information, helping the patient understand which recommendations are appropriate and when do they need a medical evaluation, like further medical evaluation. So now, as you know that you have to consult a professional guidance, the next question is, where do you access them? So you can reach them in community pharmacies or in the hospital as hospital pharmacist or a clinical pharmacist, or you can consult a physician or with your regular clinicians.
Okay, so before we conclude, let's just do a quick Mythbuster session where we'll address and hopefully clear out a few common myths and misconceptions that we see in our day-to-day lives. Alright, so let's begin with our first myth. Self-diagnosis saves time and prevents unnecessary doctor visits, when in reality, the incorrect self-diagnosis may delay proper treatment and can worsen the outcomes. So using AI or online information should never replace a proper clinical evaluation when symptoms are persistent, severe, or unusual.
So now let's get into our next myth. It is nothing but AI chatbots can accurately diagnose any health condition. But in reality, what is it? So while AI can provide a useful in health information, it can also suggest possible diagnosis based on what are the symptoms and comprehensive medical evaluation.
Our next myth is that mild symptoms always indicate a minor illness. But in reality, common symptoms can sometimes signal serious underlying conditions. That's why it's important to monitor symptoms carefully, recognize the warning signs, and seek professional medical advice whenever there is any sort of uncertainty.
So now another myth is that NSAIDs have a little to no side effects. That is a common misconception that painkillers, particularly NSAIDs, are very harmless. But although these are the medications that are currently widely available and commonly used, frequent and inappropriate use can include stomach ulcers, gastric bleeding, and can even majorly cause a kidney damage. And in few individuals who have cardiac issues will even worsen the cardiac issues.
Our next myth is that over-the-counter medicines are always safe. And this is another common misconception among people, that the medicine available without a prescription are completely safe to use. But in reality, OTC medicines can cause adverse effects, interactions, and overdose, right? Therefore, it becomes essential to read the medicine label carefully, follow the recommended dosage, and don't hesitate to consult a pharmacist if you have any questions about the safe use of certain OTC medicines.
So another myth now is, if a medicine worked before, it will work again for similar symptoms. So many people assume that if this medicine relieved the symptoms in the past, it will be appropriate every time. But however, the same symptom can be for different underlying causes. So a medicine that was suitable for before, which was even safe before, will be causing a different effect for a different illness. So you can't predict that if you're having a similar symptom, it will be the same underlying disease.
Okay, our myth number 7 is that taking antibiotics for any infection will help with its recovery. Many people believe that antibiotics are effective for any type of infection. But the reality is that antibiotics only work against bacterial infections and are not effective for viral illnesses like common cold or sore throats. And misuse will contribute to an antimicrobial resistance. So, antibiotics should therefore be used only when prescribed by a qualified healthcare professional and as exactly as directed.
So here is the final myth. Increasing the dose will make me recover faster. So in reality, what is it is, taking more than recommended dose is not going to improve your treatment. Instead, it's going to cause toxicity to your body and even treatment can fail. So medicines should always be taken exactly as recommended, because you don't directly increase your dose and get a better treatment. So if symptoms do not improve, then professional will sort out what dose to be increased, what medication to be changed. So now as we conclude this presentation, my goal in this presentation was not to discourage the use of AI, but to encourage its safe, informed and responsible use. So by combining the convenience of this AI with professional healthcare guidance, we can make better decisions, reduce the preventable medication related problems and even improve the patient safety. So throughout this presentation, we have explored the benefits, limitations of AI, seen the potential risks of self-diagnosis and as well as self-medication. We have seen the practical ways how to obtain a better AI chatbot health information and the important roles of clinical pharmacists in medication safety. So as we now come to the end of this presentation, as a final step, we kindly request you to complete the post-intervention questionnaire. So thank you for your time as well as attention. Thank you guys.